righty, guys. Well, welcome everybody to our monthly Money Life webinar. I'm Jim Allen, President and Chief Financial Planner here at Anchor Bay. Before we get started, if could maybe somebody give us a thumbs up to let us know that you can see the screen okay and you can hear the audio okay. All right, great. So again, welcome to our monthly Money Life webinar. This is backed by popular demand. This is one of our most frequently viewed webinars. With us tonight is our Medicare expert, Bob Bernardo of Medicare Benefit Advisers. And so for those of you that are getting close to Medicare age, Bob will be able to answer all of your questions about what's involved with Medicare. And then for those of you that are just considering should you switch plans, et cetera, or you have questions, we'll be able to do all that. So a couple other housekeeping items. This webinar will be recorded, and so it will be up on our website in about 3 or 4 days. So if you miss part of it or someone else who would benefit from it, you can send them to our website and be able to view it. So there'll be plenty of time for questions at the end of the presentation, so you can just put those in the chat feature, and then we'll go through all of the questions at the end. But without any further ado, I'm going to turn it over to Bob and let him give you everything you ever wanted to know about Medicare.
Thank you very much, Jim, and welcome everyone, and thank you for taking time out of your evening to learn more about Medicare. Let me change slides here. Can everybody see the agenda slide? Does that look good? So what we'll do is we'll go through about 17 slides, and we'll talk about Medicare basics and where your costs are going to come from, the top 3 mistakes that people make with Medicare, and your top 3 choices in Medicare, and then when and how to enroll. So let's do a slide change here. So on Medicare cost, and this is true for Medicare and just about any healthcare plan in the country, your costs are going to come from these 4 areas. The premium, of course, is the monthly dollar amount that you pay to have the insurance. The deductible is the dollar amount that you pay out of pocket before the insurance kicks in. And then your copay and your co-insurance costs, those are the amounts that you pay for services rendered and what you pay basically to use the insurance are those copays and co-insurance. Medicare has 4 basic parts, A, B, C, and D. Part A is inpatient hospital insurance, and Part B is the medical or the outpatient insurance. And together, those are often referred to as original Medicare because it's been around since Lyndon Johnson signed it into law back in 1965. So this brings up of the top 3 mistakes. The first mistake, and I think probably the most costly mistake, is only enrolling in Part A and Part B and not having any kind of other insurance, not credible insurance or a group plan. And the reason being is Part A and B only do not have any out-of-pocket limits or any caps on that. And I've actually seen, I had a gentleman I talked to about 5 years ago. He went bankrupt because of that. The bills just never stopped coming. So the way to avoid that is you enroll in one of your 3 options, which are a Medicare HMO or a PPO or a Medigap plan. And we'll go over all those in detail. So we have Part A and Part B. Part C are also called Medicare Advantage plans. These are the HMOs and PPOs nationwide in Medicare. And Part C replaces A and B. You're still going to have your A and your B. You're not going to be disenrolled from it. You're still going to pay your Part B premium to Medicare when you get that bill. But Part C includes Part A hospital, Part B medical, and Part D drug plans. And they work and look exactly like any HMO or any PPO you've had up until this point. With the big exception of, there's 2 big exceptions actually. Medicare usually costs a lot less and you get a lot more benefits than most any plan outside of Medicare. So then your Part D is where you get your prescription drug coverages, and there's a couple of different ways to get that. So let's look at the different parts in detail here. Part A hospital insurance is premium free. You pay nothing for that monthly as long as you have a 10-year work history and you pay taxes into the system. And that 10-year work history is the 40 quarters that they talk about in the Medicare brochures and manuals. You cannot be denied coverage in Part A or Part B. It is completely portable, meaning you can take this insurance with you anywhere in the United States or any U.S. territory like Guam, Puerto Rico, Virgin Islands. It works just as well there as it does in Orange County. The coverage and cost in Part A hospital insurance are per benefit period. And the reason why that's important is if you're admitted into a hospital for 3 days or longer, you're admitted as an inpatient, and you will immediately get charged a $1,632 deductible. That is not an annual deductible like most deductibles in health plans. It's per benefit period, and the benefit period is 60 days long. So if you go into the hospital and you come out and you don't go back in after 60 days, on day 61, it starts a new benefit period. And if you get readmitted for something else, that $1,632 part deductible is going to be charged again. So that can be charged multiple times in a year, and I'm going to show you how to avoid that. So let's go to Part B. I'll give that a second for a slide change there. So Part B is the medical insurance. This is for outpatient services, pretty much any service rendered outside the hospital, and even some things in a hospital setting where it might be done on an outpatient basis. Same as Part A hospital insurance. You cannot be denied coverage. It's completely portable. And Part B does have a monthly premium that is based on your income as of 2 years ago. So when you go to sign up for Medicare, you do that through the Social Security Administration. And when you sign up, they do a 2-year look back at your tax return. And based on that modified adjusted gross amount, that determines how much you pay for your Part B premium. And the premiums range anywhere from $174 a month on the low end, and it goes all the way up to $594 a month if you gross over your adjusted gross is $500,000, or if you file a joint return, it's $750,000. So that's the range of premiums. There is a penalty in Part B if you don't enroll in time, or if you don't have what Medicare calls creditable coverage, where for people that are delaying their Medicare, if you don't have those, you will incur a lifetime late penalty, and it's pretty stiff penalty. It's 10% a year based on the Part B premium. So that Part B premium is $174 this year. So that would add approximately $17 if you incur a late penalty every month for the rest of your life. So the moral of the story is you either make sure you have credible coverage, which will allow you to delay Medicare, or you enroll in time when you're first eligible. Let's go to so here are the IRMA charges. This is a chart that shows if you have an elevated income and how you file your taxes. So if you look over on the left, if you file individually or jointly, and your modified adjusted gross income falls into those tax brackets, it'll show you in the right-hand column there exactly what your Part B premium will be for 2024. Those premiums go up a little bit every year, so we won't know what those will be probably until October, November, somewhere there. They'll announce that for 2025. Jim, did you want to say anything about IRMA?
Yeah, so this is you can kind of look at this as an extra tax, and it's something that to some extent we can plan around. So as Bob pointed out in this chart, if say you're a married couple and you make $206,000, you're paying $174.70 per person per month, for your Medicare premiums. And you go to 206,001, and now you're at 244.60. And correct me if I'm wrong here, but Part D also has a similar surcharge. And so if you could in theory, one extra dollar of income can cost you an extra $70 a month in your Part B premiums. And, if you're a married couple, that's $140 a month. That's a big number. So we can try and plan around making sure that, things you're doing aren't going to cost you more in terms of your Medicare premiums. And the other thing is, as Bob mentioned, you go back 2 years in terms of determining, what income you're going to use because, say, for example, for 2024, your premium set, but you hadn't filed your 2023 tax returns at the beginning of the year, so that's why they go to 2022. If let's say you retire, and so your 2022 return doesn't accurately reflect what you make anymore, there is a form we can submit that says, "Hey, I've had a life-changing event. Don't use my 2022 income because it's not reflective of what I'm making going forward." And we can get that IRMA premium adjusted. But it's something we need to plan for and project out every year when we're preparing your tax return.
Perfect. And by the way, IRMA stands for Income Related Monthly Adjustment Amount. It's Medicare's polite way of saying you're going to pay more for Part B and for Part D drug plans if you have an elevated income. So in the range of premiums, or let me take that back, the range of IRMA charges for a Part D drug plan ranges from $0 up to $81 a month, in addition to what you would pay to have a Part D drug plan, the premium for that. So you typically would see that on your Medicare bill if you have an IRMA charge. And like Jim said, if when you retire, if your income drops, you can submit a form and Social Security will happily reduce your IRMA charges. So go to the next slide. So next slide, we're going to talk about Part C, which are all of the Medicare Advantage HMOs and PPOs nationwide. And they're all in all, they're good plans. They're different in a good way from any HMO or PPO that you've ever had. The one negative about an HMO, obviously, is you have to use network providers, and most people are used to that have had HMOs all their lives. Another thing is the one objection I hear about HMOs, you have to get a referral to see a specialist, and that whole process has changed significantly since COVID. I actually got a referral from my primary care doctor in the Medicare HMO that I had 4 years ago, and I never even spoke to my primary care physician. I just got a referral, and it happened in about 3 days, and I went and had cataract eye surgery, and it was actually a very pleasant experience. So every single plan in Medicare has a dollar amount attached to that plan, and we call that a MOOP. MOOP stands for max out of pocket, and that is your catastrophic number. So as an example, if you have an event and you went into the hospital and you ran up a big hospital bill, $100,000 or even $1 million, your max out of pocket is going to be whatever that MOOP number is attached to that plan. And to give you an idea, in Orange County, the MOOPs for the HMOs are between $200 and about $1,000 for most of the plans there. And so that means that's your maximum exposure. If you have a big event and you're staring at a big hospital bill, your max is going to be whatever that MOOP is. The MOOP for a PPO is a little bit more expensive. They're probably in the $1,000 to $2,000 range in Orange County, LA County. And then you have your Medigap plans. For example, the Plan G, the MOOP is the deductible. It's $240. That's all you pay out of pocket for the calendar year for 2024. And you may have seen some of the ads on TV, or if you're approaching 65, you're probably getting junk mail about the Medicare Advantage plans. And that's what they really push the most. And a lot of those ads and a lot of that junk mail are not from insurance companies. They're not from agencies like myself. They're from marketing companies. And all they're trying to do is capture your information so they can sell it to hundreds of Medicare agents nationwide. So be careful what kind of mail you respond to. But the plans are good. They have a lot of benefits that you see at the bottom of the screen here that are based on benefits that original Medicare Part A and B has never offered. Medicare's never offered dental, vision, and hearing, and over-the-counter allowances and free gym memberships and all that. So these same insurance companies that you may even have now, like United or Aetna or Blue Shield and Anthem and all those guys, they can do things in Medicare that they just can't do outside of Medicare. And the main reason they can do that is they're subsidized by the federal government to manage these plans for the government. So that's Part C. Let's take a look at Part D, drug plans. Yes, did you
Hey,
have
Bob, before you go there, I know questions I get a lot, or comments I get about Medicare Advantage plans are that you're kind of limited to that network, and so then if you move out of that network, you may not kind of have the same coverage, et cetera. And the other thing that I believe is correct, and you can mention it, is if you start with Medicare Advantage and then you decide, I'd rather just go to a regular Medigap type policy, you may have to qualify underwriting wise to be able to do that after like 12 months, correct?
That is correct. So Medicare gives everybody turning 65 either a 6-month window or a 12-month window to get a Medigap plan with no questions asked, no health history questions. And the reason why that's important is so many people have chronic conditions like heart disease, kidney disease, liver, lung cancer, dementia. If you have any of those chronic conditions, or if you take meds for those chronic conditions, and you want to get a Medigap plan after that initial 6-month or 12-month period, you have to go through underwriting and answer all their health history questions. And that's the one and only time they can deny you coverage in Medicare. So the moral of the story is you can do what I did. For example, Jim mentioned 12-month trial. There's a 12-month trial period that Medicare gives everybody. I started with a Medicare HMO in 2020, and I kept it for 11 months. And I switched it over to a Medigap Plan G, which I have now, and I'll probably die with that plan. But you have up to 12 months to make that decision to get into a Medigap plan, and with no questions asked. Anytime in the first 12 months, if you want to switch it to a Medigap plan for 100% coverage, you can do that with a phone call to me. It's a very easy process, and there's no fees or commissions or penalties or anything like that. If you go beyond that initial 6-month period or that 12-month period, and you want to get it in a Medigap plan in year 2 or year 5 or down the road, you have to fill out an application, and that's an easy thing, but there are about 20 or 25 yes/no questions on there. They're just check boxes, and they go into detail. They go 5 years back. They look ahead and ask if you've had any surgeries recommended for the future. So they want to know in detail what your health looks like. So if they're going to assure you at 100% coverage. And and I've insured people that have been on high blood pressure meds and cholesterol meds, but they didn't really have any chronic conditions. They didn't have heart disease or any of that, and they passed underwriting in flying colors. So it's possible to go beyond those initial periods where it's guaranteed issue and still get a Medigap plan. So did that answer your question, Jim?
Yeah, I think it's just something people aren't aware of, and obviously Medicare Advantage plans are promoted heavily on TV, like you said, from those marketing houses. So
right.
I kind of look at that as that's something you need to be aware of if you're considering a Medicare Advantage plan.
Exactly. So you can do that. You can start with an Advantage plan and try it. Occasionally, I've had people stick with it, and that's mainly for budgetary reasons, because the Medigap plans, which we'll get into here in a couple of slides, it is the most expensive option in Medicare, but it's also the only place in the United States that anybody can buy 100% coverage that's good nationwide. So we'll touch on that in a couple of slides here. So that's all Part C. Let's talk about the Part D drug plans for a little bit. To get a Part D drug plan, you only need to be enrolled in Part A hospital insurance, which is premium free, or Part B medical insurance, or both. Then you can go enroll in a Part D drug plan. And the two ways to get that is there's a standalone Part D drug plan. In most California counties, there's about 22 plans to choose from. Or if you go with an Advantage HMO plan, the drug coverage is bundled in there and there's nothing to add to it. So The Part D drug plans, they do have a monthly premium that can have an IRMA charge, just like Part B. We showed you that IRMA chart. There's an actual separate IRMA chart that's just for the Part D drug plans. And there's also, like Part B, there is a late penalty for late enrollment. And you can be late in Medicare in the Part D drug plan when you first start, or even after you've been in it for a few years. I've had people move, they move to a different county or they move to a different state. And the Part D drug plans and the Advantage plans are zip code based. So if you change zip codes, but if you stay in the same county, chances are you're going to have the same drug plan, but it's worth looking into. I've had people move to a different state and they completely forgot about changing their drug plan, and they eventually get a letter from the drug plan saying you're out of network now. But the change is real quick and easy. It's literally about a 5 or 10 minute process. It's simple, but that's one of the other mistakes in Medicare is people don't enroll in time in Part B or Part D, and they start incurring that lifetime late penalty. And the late penalty can be in Part D long after you've been enrolled, but you've changed your permanent residence and you maybe forgot to change your Part D drug plan. So let's see what's on the next slide. So most of the drug plans will use these three rules, and the prior authorization is exactly that. Sometimes a provider will prescribe a medication that's really expensive, or it might be brand new and really expensive, and the drug plan might require you to get that permission from the drug plan before they fill that prescription. Quantity limits, just about every drug plan will fill up to a 90-day prescription. Some meds, again, if they're expensive or if they're brand new and they're brand name, they might put a quantity limit on that, where they might only limit you to 30-day supply. I think things like some of the newer weight loss meds like Ozempic and those class of meds, they limit you to, I think, one injector pen for however long that lasts. And then there's step therapy. Step therapy is the same instance where somebody's prescribed a brand new medication and it's expensive. And if the drug plan feels there are other meds in that same class of drugs that are less costly, especially if they're generic, they may require you to try those first before they release the expensive medication. So one other thing I wanted to mention about Part D2 is we're coming up in January of 2025. There's going to be some major structural changes in Part D. And if you're already in Medicare currently, or if you've done some due diligence, you may have figured out that Part D is the most misunderstood part of Medicare, and for good reason. Medicare is the only health insurance that I know of where your meds can change prices up to 3 times in a single year in any of these plans. So the way it's structured currently, there's 4 tiers of pricing, or 4 stages of pricing, I should say. Stage 1 is the deductible phase, and the maximum premium or the maximum deductible that any plan can charge you this year is $545. Some plans charge that. Some plans charge nothing. Like, as an example, most of the Medicare HMOs in Orange County, they have no deductibles. And then some plans charge something in between. They might charge $200 or $300. So when you meet that deductible, then you go into stage 2, which is called the initial coverage stage. In the initial coverage stage, this is where most people are going to get their best pricing on med. The generics are real cheap. If they're not zero, they're something close to that. Brand name medications, most of them are expensive, more expensive than generic med, but they price them pretty competitively. And when you're in stage 2, the initial coverage stage, Medicare monitors the retail price of the med that you're buying, not what you're paying, but the retail price. And when that threshold hits $5,030 in this year, in 2024, then you graduate to stage 3. Stage 3 is called the coverage gap or the donut hole. Same thing. If you hear somebody say coverage gap or donut hole, they're talking about the same thing. That's stage 3 in Medicare Part D drug plans. And I don't know where they came up with the names, but they're actually, those 2 names are going to go away next year. So in the coverage gap, everybody pays a flat 25% of the retail value of the meds. And for some people, they're going to notice a price increase if they go into the coverage gap. For other people, they might already be in a plan where they're paying 25% of the retail value in that initial coverage stage. But nonetheless, so when you're in the coverage gap, the next threshold jumps up to $8,000. And Medicare calls that the troop. Troop stands for true out-of-pocket expenses. And the big misconception here is to go into the fourth and final stage called the catastrophic stage, that we have to pay $8,000 out of pocket as customers or individuals. And that's not the case. What happens is anybody that pays approximately $3,400 out of pocket, they're going to go into the final stage where they pay zero. So that $3,400 that they pay out of pocket gets credited towards that $8,000 threshold. The drug companies, the pharmaceutical companies, discount their medications to 70% to Medicare. Medicare credits that 70% towards that $8,000 threshold. And then lastly, the drug plans themselves pay 5% of the cost of the medication. So you've got yourself paying 25% of the cost. The drug plans discount it by 70%, and then the pharma companies discount their meds to Medicare by 70%, and then the drug plans discount it. They pay 5% of the cost. So when all that hits $8,000, you move into the fourth and final stage this year. It's called the catastrophic phase. And for the first time in the history of the Part D drug plan since 2006, you pay zero if you make it all the way across those four stages of Medicare. And right now, with that $8,000 max out-of-pocket number, only about 3% of the Medicare population makes it all the way across to pay zero. That's going to change on January 1st, 2025. What's going to happen is stage 3, the coverage gap or donut hole is going to be sunsetted, and it's going to be completely eliminated by Medicare. So next year, we're only going to have 3 stages. That is the deductible stage. And I've been told that $545 deductible, instead of increasing, they're saying it's going to drop $5 to $540. So you meet your deductible, if there is a deductible in the plan you're in, and then you go into the initial coverage stage. And the big difference for next year is in the initial coverage stage, everybody's going to pay 25% of the retail value. For some people, that is going to be a price increase. For other people, it's going to be a non-event. But when you get into stage 2 next year, the $8,000 threshold drops down to $2,000. And what that means is a lot more people that are paying over $2,000 out of pocket will make it into the third and final phase next year, which is, again, the catastrophic phase. And that's where they're going to pay zero for any and all meds. So those are the changes coming up. And I personally think what's going to happen this fall during the open enrollment period is we're probably going to see some price increases in the monthly premiums. They're limited as to how much they can increase the price, up to $35. That's a big jump. So, and just to give you an idea, the drug plans this year, the monthly premiums range from less than $1 a month. There's a plan out there called WellCare Value Script. It's the plan I have with my Medigap plan, and the monthly premium is 40 cents a month. And on the other end of the scale, there are drug plans that charge well over $100 a month and monthly premium. And what determines that are the meds that you take. If you take a handful of generic meds, you're probably going to be in a plan like that WellCare Value Script plan. And what the best way to find out which of the 22 plans that are available has the lowest cost, anybody can go to Medicare.gov, the official website. You can use their plan finder to put in your zip code, your medications, and your dosages. You pick a few pharmacies and you hit enter, and it sorts the 22 plans with the lowest cost plan right at the top of the list. So it's really a no-brainer. Medicare takes all the guesswork out of it for us. They tell you, based on your current prescription meds, this is the lowest cost plan based on the monthly premium, based on the deductible, if there is one, and the cost of the meds. So I think we're going to see some price increases in that. And one of in the monthly premiums coming up in the October open enrollment period. And I think one other area that's going to be affected is it's called creditable coverage. So creditable coverage is defined as drug coverage that's as good as Medicare or better. So what happens when somebody turns 65 and they delay Part A and B, you can do that as long as you have a plan that is credible coverage. And most every employer group health plan is credible coverage. That's going to change on January 1st, 2025. Because remember, the new max out of pocket for Medicare drug plans will be $2,000. So if you're over 65 and you've delayed your Medicare penalty free, and your plan at work has a deductible that's over $2,000, it won't be credible coverage, and you can incur lifetime late penalties. And again, the late penalties in Part D are not that stiff. They're reasonable, but they never go away for as long as you have Medicare. So there is a workaround here, and the workaround is you can join Part A hospital insurance. It's probably going to be premium free for you as long as you have that 10-year work history. And with Part A only, you can get a Part D drug plan, hopefully a low-cost drug plan, maybe the WellCare Value Script plan. I anticipate that premium is going to go up from 40 cents a month. So you get a Part D drug plan, and you're not obligated to use the drug plan, but if your drug prices are lower cost in the Medicare plan, you're certainly welcome to use it, but you can continue to stay in your group health plan, especially if you have a spouse or family on it, and especially if you contribute to a health savings account. So that is one workaround. But again, if you are contributing to a health savings account and you join any part of Medicare, you cannot make those contributions any longer. So that's another thing to consider. If you get a letter, you will get a letter from your insurance plan if you have delayed Medicare A and B. That letter usually comes out in the fall, late September, and it tells you if your company plan is credible coverage and you can continue to delay Medicare A and B penalty free without incurring those lifetime late penalties. So next year, here's what happened too. Medicare almost overlooked the whole credible coverage thing, and they didn't find this out until earlier this year when they released the proposed changes they were going to make. They put it out for public comment, and a lot of people wrote in and said, wait a minute, I've delayed Medicare and I don't want to be paying late penalties. Is my employer plan going to be credible coverage? So Medicare said they're going to give everybody a 1-year grace period. They're not going to make any changes to the credible coverage in 2025, but you definitely want to read the letter. If you're in that situation, you've delayed Medicare, you still have your employer plan, you want to read the letter from that employer plan insurance company to make sure to see if they change it and they make it credible coverage for 2026 or not. If they don't, just as an example, and you incurred a late penalty, let's say you incur a 12-month penalty, you're out of Part D and you just forgot to enroll. That penalty, that 1% per month penalty, is based on the national average Part D drug plan premium. They're expecting that premium to be just below $38 next year. So 1% of $38 is only 38 cents. And if you're out for 12 months, that's about a $4.50 lifetime penalty. So it's not going to break the bank, but again, it never goes away. So those are some things to consider with Part D drug plan. And I know you may have questions, which we'll get to here in a few more slides. Let me jump on into the Medigap plans here. So Jim, can you see that change in the Medigap chart?
Yep.
Okay, so here are the 10 Medigap plans that exist. Out of those 10, there are 2 plans that probably get 98% of all new Medigap business in Medicare, and that's Plan G and Plan N. Plan N is a good alternative to Plan G if there's some budgetary concerns there. Those plans are usually about $30 to $40 less, but they're not 100% coverage. You will have ongoing copays for doctor visits and emergency room. And there's another charge. If you see it on the chart there, it's about the fifth line down. It's called excess charges. And you could incur an excess charge, and that's a 15% charge that a provider can add onto your bill if they're not contracted with Medicare, but they accept Medicare rates. Medicare allows them to bump the bill up by 15%. In all reality, only about 5% of the doctors do excess charges. So you'll probably never see it, but it could happen. So Plan G is by far and away the most popular Medigap plan in the United States. It gives you 100% coverage anywhere in the country with any provider that takes Medicare. That's 97% of all providers. And it has a lot of good things going for it. As a matter of fact, let me jump over to the next page real quick. And I put together a list here of the 8 most common reasons why people buy the Medigap plans. And we kind of talked about the 12-month trial period, where if you wanted to start your Medicare with an HMO or a PPO, you could try that for up to 12 months. So you have that window of opportunity to get a Medigap plan that's guaranteed issue, meaning they're not going to ask you any health history questions. So you have at least 6 months. If you don't do anything in 6 months and you just have Medicare A and B, you can join a Medigap plan that first 6 months. Or if you join an Advantage plan, you can push that 6-month window out to 12 months. I talked about the MOOP for all plans, the MOOP max out of pocket, the number associated with every plan. The MOOP for the Plan G is $240. So this is the big difference here between a Medigap plan and an HMO or a PPO. With an HMO or a PPO, you pay as you go. Most of them don't have monthly premiums. So if you don't use it, it's not going to cost you anything monthly other than what you're paying to Medicare for your Part B premium. So with a Medigap plan, you pay more in monthly premiums up front. The starting premium for somebody new to Medicare is right around $150, give or take a few dollars. So you have $150 you pay up front, and then very little cost on the back end when you go to use the insurance. So again, the Plan G max out of pocket is $240. That's the Part B deductible. So when you've met that deductible, the Medicare sends your share of the bill to the Medigap company. And who, regardless of who that company is, they are not in the decision-making process at all. They have no say whatsoever in your health care. They're there to pay your share of the bill after you meet your deductible, and that's all they're there for. They do nothing else. And it works exactly like that. So we talked about the portability. If you move or if you're on vacation or if you go anywhere in the United States, the Medigap plans work just as well as they do at home. The core benefits of all 10 of those plans are set in law by Congress. They will never change in our lifetime. And because of that, it's a lifetime contract because they never change. The only reason a Medigap insurance company can cancel you is if you don't pay your monthly premium. So that's why I recommend to anybody and everybody, if you get any bills in Medicare and you can only get 3 bills monthly, put them all on auto pay and forget about them. Because if you get kicked out, if you get kicked out of a Medigap plan, you would probably have to go through underwriting to get back in. So the next 3 bullet points here, no networks, no referrals required, and no pre-authorizations are probably the main reason that people get Medigap plans, because it gives you complete control over who, when, and where you doctor with, whether it's locally or a hospital out of your area, like it could be Cedars or USC Keck or any of those hospitals. Could be the Cleveland Clinic or the Mayo Clinic. And you can still go there with original Medicare insurance. And lastly, it is guaranteed renewable for life. The only thing that's going to change in a Medigap plan is the premium. It's going to go up a little bit every year. As you get older, it gets more expensive, as does most insurance. But those are the top 8 reasons that people buy Medigap plans. And on the next page, the next slide here, these are the 6 gaps in Medicare, all of Medicare, that will cost you money. So you see 3 gaps on the A side and 3 gaps on the Part B side. And Plan G covers 5 of those 6 gaps. The only one it doesn't cover is the Part B deductible at $240, and that happens to be your MOOP. That is your max out of pocket for calendar year 2024. So let's say that deductible goes up next year $20 to $260. That would be your max out of pocket next year. You may hit that deductible early in the year. If you hit it late in the year, it resets every year, every January 1st, calendar year. If you don't hit the deductible and you're healthy and you don't go to the doctor a lot, that's money in your pocket as well. So save your questions for Medigap plans. We're just about done here. Waiting for a slide change. So here is when you can enroll in Medicare. Most people do it in the 90-day period prior to their birthday month. And by the way, Medicare always starts on the first calendar day of your birthday month. That's the earliest it can start. And if you enroll during your birthday month or in that 3-month period after your birthday month, you can do that. You won't incur late penalties. And it will start on the first calendar day of the following month. So you can see the link here below. I can email this to you if you don't copy it down, but that's where you go to create your Social Security account, and that's where you go to sign up for Medicare Parts A and B. And then down the road, when you're ready to pull the trigger and get Social Security benefits at whatever age, you just log back into your Social Security account and sign up for Medicare, or the Social Security benefits. And they're both very easy applications. I've done both for myself, and they take about 15 minutes. You don't have a lot of running around to do. It's pretty easy to do. So the next slide is has
Bob,
nothing.
before you go there, just
Yeah,
a quick question. We'll have clients who'll sign up for Social Security prior to Medicare eligibility. Maybe
Right.
we'll sign up one of the spouses for early benefit. If they're already on Social Security, do they get auto-enrolled in Medicare, or do they still need to enroll?
They do get auto-enrolled. So that's a good point. When you
Okay.
are getting Social Security, and a lot of people took it during COVID at age 62, and here's one of those mistakes. People get Social Security, and then they get Medicare automatically at age 65. So they get their red, white, and blue Medicare card in the mail. And Social Security also defaults them into a Part D drug plan so that you don't incur late penalties. Then you get a drug plan a card in the mail. And so people look at that and they go, okay, I've got hospital insurance, I've got medical insurance, and I have drug coverage. Looks just like my HMO plan I had at work. And that's where they stop. And remember, that's that biggest mistake, is having Part A and B only. And that's when you have no limit to your out-of-pocket expenses. So whatever bill you run up, whether it's a big hospital bill or outpatient services or a doctor bill, you're responsible for 20% of every bill until they stop coming. So yes, if you get Social Security benefits, they will enroll you in Medicare A and B automatically. And I think it's about 3 to 4 weeks before your birthday month, you'll get your red, white, and blue Medicare card in the mail. When I got mine in the mail 4 years ago, it came in this little brown windowed envelope, and the return address said HHS, which I happen to know was Health and Human Services. That's the parent company, division of both Medicare and Social Security. So I opened it up, and there was my Medicare card. And a lot of people throw that away because it looks like junk mail. So if you sign up online, and that's the best way to enroll in Medicare, is to go to that link and create your Social Security account. Then you can get in there and you can enroll in Medicare Part A and B. And if you do that online, they'll mail you a benefit verification letter. And in that letter, in the body of the letter, it has your new Medicare number. They PDF that letter and they'll post it right on your Medicare account, right on the homepage. And you can actually click into that and get the letter or get the Medicare number off of that. And that's all I need to enroll you. And that's important because sometimes people wait till the last week of the month when their insurance is going to expire. Their group health plan might be ending at the end of the month, and they need to get Medicare started right away. That's the quickest way to do it. You can also call Social Security. They will enroll you over the phone. They will set up an appointment anywhere from 3 or 4 weeks out, and they'll call you back and enroll you over the phone. Same process there. So I was going to say one other thing, and I forgot my train of thought there. But anyway, any other thoughts, Jim, on enrolling in Medicare?
No, obviously it's something when we're doing our year-end reviews or mid-year reviews, and that's coming up. We obviously make sure that you're aware and that you get signed up within the timelines
Yeah,
because we don't want to
it
incur
is.
those penalties.
That's a easy process. Enrolling in the plans is an easy process. Yeah, that's probably the easiest part of the whole deal. When you're ready to get into a plan, what I basically do is log on to that insurance company's website. That's why I'm contracted with so many different companies, and I fill out their electronic application. Then I call you back at a predetermined time, and we just go through the application. And there's a few disclosures on there. When I hit submit, it sends you an immediate DocuSign email. You just basically open it up and type in your name and the date, and you hit enter, and you're done. It's that quick and easy. So let me go back to. So the last slide here is nothing to do with Medicare, but it has everything to do with your travel plans after you retire. Uh, don't wait till you retire to do to do the traveling. Here's a couple of 50-year-old Medicare agents after the open enrollment period last year. They just didn't. They just blew it all in Venice, Italy here. So that is end of
That
presentation.
picture looks like us after tax season as well.
I know the same. Yeah, it is. You're an enrolled agent. You know how that goes. So same thing in Medicare, except just in the last quarter of the year. So here's some resources that you could write down, and I put this number for Social Security on here so you remember to never call it because that is their national call center, and you can during the year before October, the first 3 quarters of the year, if you call that number, you'll sit on hold for about 2 to 3 hours. I have a spreadsheet of every local Social Security office phone number. And when you call that number, there's 3 offices in Orange County. There's one in Fountain Valley, one in Anaheim, and then the one in Mission Viejo. You can call them, and you usually get a live body on the phone in 5 or 10 minutes. And they're very helpful. Their job is to help you with Medicare and to help you with Social Security when that time comes. You can call Medicare if you have questions about how to set up their auto pay for your Part B premium. You can call them 24 hours a day. And even during the day, they answer the phone pretty quickly, as do I. So I invite your questions anytime. You can pick up the phone and call me 7 days a week. I don't care if you call me morning, noon, or night. All I do now is Medicare. When I first started 7 years ago, I did supplemental plans like dental, vision, hearing plans and things like that. But now I'm so busy with Medicare, that's all I have time to do. So let's do some questions. Does anybody have any
All
questions about
righty. Yep.
anything?
Yeah. If you have questions, go ahead and put them in the Q&A box. We do have one at the moment. I'm assuming this is talking about Medicare premiums or IRMA or both.
Okay.
Is it per person or per month for the joint couple?
That's a great question. There's nothing joint about Medicare at all. The only thing that comes close to being joint is if you file your taxes jointly, you're both going to pay the same premium each. So, and remember that range of premiums from 174 all the way up to $594 per month. So, if one of you, if one of the spouses turns 65 and they get Medicare going, then when you turn 65, you're going to be paying the exact same premiums that your spouse does. So it's completely individual. There's nothing joint about Medicare. So typically, if one spouse is turning 65 and the other one is a year, 2, 3 years away, a good alternative would be to look at Covered California, ACA, Obamacare. It's all the same thing. It's pretty reasonably priced. It's also based on income. So if you're going to have an IRMA charge in Medicare, uh, then you would probably pay a little bit more for Covered California. I don't sell Covered California, but I have people in Orange County that handle that for me when people need that type of insurance before they hit Medicare age. So good question.
Yeah, and I'd come in generally, working with our clients, if you're on, say, Covered California, when you get to Medicare, even with the Plan G, the best Medigap policy, you're going to see a raise in your income because it's substantially less, unless you're in IRMA, obviously. But if you're just normal Part B than and a Medigap policy, it's probably half of what you'd pay for a not nearly as good covered California plan.
That's true.
And so we,
So, and here's another thing too. A lot of people don't realize Covered California is designed for the under 65 crowd. They expect you to go into Medicare and get off Covered California at age 65. I have a guy that I've been talking to for about a week now, and he called in and he's 67. He delayed his Medicare, and he did it with Covered California. And it's my understanding that Covered California or Obamacare nationwide is not credible coverage. I said, go ahead and apply for Part A and Part B. And when they ask you what kind of insurance you have, put on there what you have. And maybe, just maybe, if they just look at it as continuous coverage versus Obamacare, they might not ding you for a 2-year lifetime late penalty. But we're waiting to hear back to see how that's going to pan out. But there are insurances that don't count as credible insurance coverage, and those are VA benefits, Covered California, uh, uh, retirement benefits, and then COBRA. So those 4 insurances, and this happens pretty often. Somebody will retire from a company after 20, 30, 40 years, and they have a nice retirement plan, and or they get COBRA, and they sit on that for 18 months, or they're in the retirement plan, and something changes with that retirement plan, and that happens every so often. And then they go to sign up for Medicare, and they're staring at 2 to 3 years of late penalties, and that's pretty stiff. So just beware. Either consult with Jim or myself. Again, you can call me anytime. There's never a cost or any fees for my services, and I'll help you get where you need to go without incurring those late penalties. So,
yeah, so we have one more question before
okay.
we wrap up.
Yeah.
And maybe I don't know that we know this definitively yet, but do we know what the COLA for Part B is going to be? I don't believe so. I haven't heard anything.
Not yet. There you see rumors out there, but I think what was it last year, 3.2%. So we'll see. It's probably going to be in that neighborhood. Then I believe they announced it in October.
Yeah, I believe so. It comes out the same time as Social Security and all the others, and so
Right.
yeah, I think you're probably right. It's generally in the range of inflation, which right now is just a tad over 3.
Yeah. Yeah. So yeah, hopefully they get that under control, and we can get interest rates going back down, and but everything is looking good right now. Just know that Medicare works and acts like any insurance you've ever had, with the exception that it usually costs less and you get a lot more benefits. So, and you've got options here in some of these HMOs and PPO plans that are very attractive. But and really, I liken Medicare to that old. It's good, better, best. The HMOs are good. They're uh, better than any HMO that I've ever had. The PPOs are a little bit better, and then the Medigap plan is as good as it gets. A Plan G doesn't get. You can't get better insurance than that. It doesn't have a lot of bells and whistles with it. It's just pure hospital insurance and pure medical insurance. But again, it covers you at 100% after a real small deductible on the back end. So,
Yeah, well, thank you, Bob, for doing this. Obviously, you see Bob's contact information on there, and you can always reach out to us. I mean, we're not the experts on the individual plans, but we obviously incorporate Medicare planning into your retirement income planning. And as an FYI, our September Money Life webinar will be on all of the recent changes that have happened to retirement plan required minimum distribution. So there's a new tax law called Secure 2.0 that's came out, and then there's some new IRS regulations that affect when you have to take required distributions from retirement plans. In particular, it's clarified a bunch of stuff around if you have an inherited IRA, et cetera. So we will have that in September. Look for an announcement in our monthly newsletter, as well as Blake from our team will be sending out announcements. So this will be posted on our website in 3 or 4 days. If you have any questions, you can reach out to me directly, or obviously you can reach out to Bob directly too. He's the expert. And so we appreciate you guys coming out, and hopefully we'll talk to you in the next month.
Thank you,
Thanks, guys.
Jim. Thanks a lot,
All right,
everybody.
thanks, Bob.
Yep. Good night.
Bye-bye.
Uh-huh.